Oftentimes we have patients who have herniated discs, and they sometimes require surgery and sometimes they don't. Well, what happens if we leave your disc herniation untreated? What happens? Well, there's two indications for back surgery with regards to a herniated disc. One is severe pain that's intractable, that will not get better with conservative therapy. And the other one is neurologic deficit, weakness, numbness that is not improving. We usually give people 6 to 8 weeks to get better. And if they're not getting better, we sometimes recommend surgery. Now, if it's left untreated, usually the pain will get better over time. If they have numbness and weakness and it's left untreated, you could be left with permanent weakness. We don't like that. We don't want you to be permanently weak. We want you to be normal and recover. So it's a minimally invasive surgery if you need it. But if it's left untreated, it can be dangerous with regards to motor strength recovery primarily. Pain usually fades over time. And oftentimes, many herniated discs don't need surgery, even if they're large, if they're not causing the symptoms I mentioned. So that's what happens if a herniated disc is left untreated. I hope that answered your question today, and I'll talk to you next time.